Hey there, guys. Welcome to today's episode where I'm joined by Dr. Arjun, who's going to give us a bit of background as to what you can do as an overseas dentist who's looking to work in the UK. Or if there's any other plan that you might have in mind, Dr. Arjun is definitely the man that's going to help you out to understand what you can do with your professional career moving forward. So I'll hand it over to him right now, and he can give us a bit of an introduction, a bit of a background on his journey and what he has to offer today to help us all. So, Dr. Arjun, over to you, my friend.
Perfect. Thanks. Now, I appreciate that. Good to be here and looking forward to getting into this topic in a lot of depth. So, yeah, my name's Arjun. I graduated from Madrid in 2021. And then after that, I did the whole process of coming back to the UK to work as a dentist. So, I went through that whole process of GDC registration, formless application, and effectively your first year of working as a dentist. That's just a bit about myself.
Great stuff. Great. So, obviously, you've had the hard stuff. You've done the thing that everybody's dreading. I think even myself, I'm dreading it as well. So, you're definitely the right man to be here on today's episode to help us all out. So, let's go over to the questions. I've got a few questions to throw over onto your side. The first one is kind of, what is it that you offer to graduates and students alike in terms of getting them up and running and set up for the future? Because obviously you do offer a service or something that would help people out. So let me hand that over back to you, and you can give us a bit of background on that.
Yeah, so when I came to the UK to work as a dentist, obviously there was a lot of uncertainty and it was not really clear for us on what the processes are for the steps after graduating. In comparison with somebody who graduates from the UK, they have that structured program for the dental foundation training. And they do offer this for non-UK graduates too, but places I've been seeing are becoming more and more competitive. That is the primary option for UK graduates. So they get prioritized to get those places. So what you'll commonly find that there are many companies that offer a mentorship service to help guide you through that process. So what I do is effectively this as well. So I help, as I've gone through this whole process from start to finish, from GDC registration up until getting my actual performer number, I'm very clear about that whole process. And I've been actively doing that even when I was working as a dentist. When I was working with Dental Care Group, I was involved in re-establishing their training program for them. And now I'm independently running my own training program that helps not just Dental Care Group, but Dental Care Group and all the practices around NHS England.
Okay. So as you said, people that are coming over, they need to understand that then they have to go through a form of mentorship. So that's kind of a very, very strong sticking point that everybody needs to understand and grasp. And then obviously you've explained that, you're the type of person that can help out with that mentorship, or at least getting people onto a program. So is that just to clarify, that's kind of where you're coming from, right?
Yeah, so when you see about mentorship, you're gonna hear, if you talk to any practices or any other dentists, you're gonna hear mentorship being thrown around that European and overseas dentists need to do. What they're referring to is what is one of the requirements that NHS wants from you, is that you have a period of workplace supervision. That's what they call. That's the word that they used to call it. So this workplace supervision, typically for newly qualified dentists, is anywhere between 6 months to 12 months, usually closer towards 12 months. But for the recent months, I've been seeing dentists are getting less and less, like average, you can say about 9 months, but anywhere between 6 to 12 months of that period of workplace supervision, which is what we call like mentorship. So that's where you have a dentist who is at least 4 years experienced with the NHS system after their foundation training or equivalent. They are then there for you to support you in clinic to help you with your development as a clinician.
Mm-hmm.
So in regards to mentorship, you can get all that on paper of the clinical mentorship and those requirements you need to do. But what I found is even more valuable that you won't see in any contract is the real mentorship that you get from the others around you, the other dentists, maybe the clinical leads of the company that you choose to work with. They can play a crucial role in the start of your career. And personally for me, because I had a great start to my career, obviously some people don't, they have issues with where they're working for whatever reason. Just like it's at university, when you're in your clinical groups, some people might have professors maybe they have a good time with, some may not be. So It's like that everywhere. It will translate to when you start working. I was quite lucky in the sense that I had a really good start. I enjoyed every moment. I looked forward to going into work. The people were great. The patients were great to treat. And just the whole development side from clinical to non-clinical was there. And I took advantage of it. And I want other people to have that same good experience because I know and I can see what like the green flags and red flags are in a place to look for. And that can, I feel I can really help other students like who have a similar background to me and you. So who have,
Yep.
whether they're from the UK or not, but if they're studying in Europe or overseas and they want to work in the UK, I'm very clear about that. And I want to keep continuing to support dentists through that process.
That's perfect. It's good to see people out there that are trying to help. I think we're in a community where people are always looking for help and can find it quite hard to locate that help. So, big shout out to yourself for doing what you're doing, and more power to you. I hope that continues. So that's really good. I think that's good insight to anybody out there who's trying to understand a bit more as to what the journey looks like post graduation. So thank you once again for giving us a bit of a breakdown onto that. So let's move on to the next question that we've got here. You've kind of done all of this. Some people might actually ask. Now, obviously, you've had the experience and whatnot. But what kind of took you to that inspiration to say, do you know what? I actually want to set something up to help other people. Because obviously, you've touched on it right now that you want to help other people. But what's taken you from just enduring that entire experience and then saying, do you know what? I could actually help and create a service that a lot of people can benefit from. So, what was the mindset behind that?
So to phrase it, I would say there's like two ways that motivates someone. Someone's either driven by something or they're dragged through some kind of insecurity, you can say. So you could be driven by, let's say, like profits, like you just want to earn money and do something like where there's a need for it, which is fair enough. That's if someone wants to do that, that's okay. There's nothing wrong with that. I took a different approach. Like I was dragged in the sense by not insecurity, but I didn't get a place for dental foundation training, but I valued that. So I valued that scheme. So either you want to go into dental foundation training or you just want to go straight to becoming an associate dentist. So the reason why I valued like a foundation training was in essence that there was clinical education and there was development in yourself professionally, even on the non-clinical side. So
Right.
foundation training, I personally believe is essential for any dentist in their first year of working, whether that's you're a UK graduate or an overseas or European graduate. I personally believe it's essential. And the reason why is that there are people out there who have gone through that process. They've made those mistakes before. So you don't need to make that yourself. So it could
Mm,
be anything from, for example, undercharging, undervaluing yourself. So when you're a newly qualified dentist, you might not feel that, oh, I shouldn't be charging this much. But people have gone before you, people have done that, they've made that mistake, and they can help you give you that confidence as to why you should be charging those prices, why you should be valuing yourself more. So the idea behind this is that because I've gone through that and I've seen from other people and mentors myself the mistakes they've made, we can effectively shorten the period of time of your learning from university clinic to real world dentistry. So the reason
ah,
behind is that I just want to help support dentists like myself to have a quick, fast way so that they become a safe, confident, and profitable dentist. Those are points
ah.
I think that are essential for a foundation dentist.
Perfect, perfect. Okay, that's great stuff. Thank you very much for that. So what I've got here is obviously some questions coming in, some from the community, some from myself. What should dentists from abroad, so dental students especially, what should they be aware of as they're finishing university? So as they're approaching that time, I mean, we're even looking at it now. There's probably some final years that are kind of prepping for graduation in a couple months' time. What should they be aware of if they're trying to get back to the UK? And what would you kind of give them in terms of advice as to that preparation and mental prep so that they're hitting the ground running and they're ready for work?
So the first biggest thing that I'll suggest that is a common cause of delay for people's applications, whether that's GDC or the NHS performance application, is you need to make sure you have your clinical references. And you need to have that conversation with your professors. You should have had them now, or if not, at least start having that conversation now to say that, look, I'm going to be applying to be a dentist in the UK. Would it be okay for you to provide me a reference when I need it? So if you have those conversations and if they're aware from it, then you can reach out to them when that time comes. So that's one of the biggest things to do when you're starting that process. at this free time. Another thing you should look at your specific requirements in the sense that with the GDC, what do they want from your university? So, for example, with my university in Madrid, I needed to provide a letter that said that the course was at least 75% taught in English, even though I'm a native English speaker.
Right.
So there's nuances like that that you should really look into to see maybe what the people before, what they've done to get in that process to be GDC registered. But start initiating that conversation with the GDC now to get your application ready. And then once you graduate, make sure you get your actual diploma or your provisional degree that the university sends you once you graduate. So you have those documents in hand. And then if you check the GDC requirements about what you need to apply, that should put you in a good standing to speed up that process so you can become a dentist in the UK faster.
Okay. And then just so we got a bit of a time frame, because obviously some of us have never experienced it as yet. How long did it take you to get your clinical references? Just so we know, obviously every university is going to be different. Every country is going to be different as well. And some universities may not be as cooperative as maybe yours was. So how long did it take you from that point of asking for your clinical references and actually getting them in hand? Because obviously that insight is going to help quite a lot, because some people might think, right, I'm going to graduate, then I'll ask for it, and it might set them back a couple of months. So how long did it take you?
Okay, so I could say it took me from the start of me going to the clinic up until the end of my clinical year. So you need to build a relationship with the reference. You can't just straight up ask them at the end of the year, oh, by the way, can you sign me off when I need you as a reference? You need to actually have a real relationship. And the reason why is that they can then give you a real reference about yourself, and they'll want to do that for you. They'll want to do it as fast as possible. Everyone knows that when someone's asking for a reference, if they submit that reference sooner rather than later, obviously it's going to be better. But you need to have that relationship to start with in the first place with whoever you're asking. So that's why when you're starting the year, have that conversation now. If you haven't had that kind of conversation, I would suggest start having that conversation now, because as you're approaching the end, everyone's going to probably be asking for the reference. Like, oh, can you, professor, can you give me a reference, please? I'm going to be applying for the GC. Most will probably do it, but if you spend the time to build a meaningful relationship, that will help you in the long term.
Okay, so that's quite interesting. Obviously, having rapport is a major piece of advice that you've given us. Really appreciate that. In terms of what needs to go into the reference, is there anything that's very specific by the GDC, or is it again based upon what the uni provides?
No, typically they don't require a detailed response. It's not they're evaluating how good the reference is. They just effectively they want a reference that can just say who you are. You say you are who you are.
Yeah.
Effectively. NHS the formalist application, they ask for a more detailed clinical reference, like a checkbox saying, does this dentist communicate well with patients? Are they clinically sound? The NHS ask a bit more detail versus the GDC. The GDC is more of a character reference, I believe. They just want to effectively see you are who you say you are.
But the NHS one, that's kind of after your training, or is that still before you've applied for the NHS performer number? Like before you've applied for your training?
So before you apply, so as you submit your application to be an NHS dental performer, they're going to ask for basically details about yourself and who your proposed mentor is going to be.
Right.
Even during your training, they will also ask you at intervals, which they'll work through with you when they want those intervals, for a clinical reference from your mentor. So, but that'll be when you're in clinic. But the steps before clinic that you need to have with the GDC is a character reference, and for submitting a performance application, you'll need two clinical references, I believe.
Okay. And then, as you said, for the NHS part of it, it needs to be quite detailed. So you need to know all of this before you've even graduated, so to speak. So
yes. So with the NHS, so with the NHS, it was literally for my one a few years ago. It was they just had to tick box a few things on a scale 1 to 4 or whatever it was, and then if they want to leave a comment, they can. So when you're getting a clinical reference, you don't need to stress about the content too much. You just need to make sure you have a clinical reference, someone who can attest to what your clinical abilities are.
I'm with you. And then just something that I'm just thinking about as it kind of floats in. For anybody who's who needs the information, because we're talking about things as though everyone knows what we're talking about, right?
Yeah.
Just to clarify, dentists that want to practice in the UK, essentially have two options, don't they? Because they can, as long as they're registered with the GDC, so be that through the European route, the UK route, or they've completed the ORE, they can kind of just work pretty much straight away on private work. That's correct, right? Unless they want to do
Exactly.
NHS work, it's different. So do you want to explain that real quick?
Yeah, exactly. So once you're registered as a dentist with a GDC, you can start working immediately. So you can start treating patients privately. That's not an issue. When we're talking about the NHS side of it, why you should it's a separate application to your GDC. So to apply to be a dentist that can do NHS dentistry, it's a separate application that you have to be GDC registered for.
Mm-hmm.
So that's the difference. You can either become a private dentist if you want to work straight into private dentistry, or you can do a mixture of both, private and NHS, and less commonly, just exclusively NHS. Usually, from what I've seen, is that people either are going down the private option or doing a mixed approach with doing NHS and private dentistry.
But then, obviously, as you said quite early on, your advice is take the NHS route just to get the learnings, learn from other people, get the advice, that foundation that you need to be a good dentist in the first place, and then kind of take the route after that as to what you want to do, right? So I'm assuming that that advice sticks.
Exactly. So the reason why I would suggest taking the approach to consider doing NHS dentistry first is because you're just going to be doing more dentistry than what you would be doing as a private dentist. You're
Yeah.
going to be seeing more patients. You're going to be building your experience at a faster rate than if you were just to go down the private option only. When you qualify and start working as a dentist, what you're going to find is the typical timeline is that, let's say you graduate, you send your application to become GDC registered. Once you're GDC registered and you start working in clinic, from that moment you're beginning to treat patients privately. At the same time, you're going to send off your application to be an NHS dental performer. And for your NHS dental performer application, for it to be submitted, you need to have a clinic that you're saying that I'm going to be working here and this is my mentor. So naturally, you're going to be working initially for a few weeks privately. And in that time, it's a really unique period of time because you're going to be seeing fewer patients. So what that means is you will have the time to understand everything, understand how to use the computers, understand how to work with a nurse, understand how to work with reception, understand how to work with your practice manager. So you can take advantage of those initial weeks to take your time to do those things. Take your 30 minutes, 40 minutes, however long you need to do your full examination, however long you
Mm.
need. Take your 2 hours or whatever to do your root canal treatments. Take your time, because once you take your time, you'll refine your clinical protocols. You'll know all your steps. You'll know what to do because the priority is that you're practicing safe dentistry and good dentistry.
Yeah, yeah,
So
yeah.
the speed aspect will come with time because you're going to be in that routine. You'll know what to do. You'll know the steps and what to do. You'll know how to work. Your nurse will know how you work too, which will help speed things up. So your primary focus in your initial weeks and months is to make sure you're doing good dentistry and you're building your own personal protocols.
Sounds good. Sounds good. There's a lot of background noise going on there. So
Yeah, it's a bit shady. Do you want to
it,
repeat that part?
no, it did come through. Don't worry. I'm sure anybody listening could probably make that out. Just I say it in the comments. What do you think that was in the background? It sounded like a car wash to me. So no idea what's going on over there.
I won't say, I won't say what it is.
But you know what? We heard you, and I think that's a very very strong point that people do miss out. I mean, even I didn't think of it like that. It's one of those things that we kind of just see it as a case of let's just get over, let's just get into clinical practice, let's get as much work as we can done as possible. But people don't realize that note taking, especially in the UK, is kind of like the make or break for any dentist because that is the thing that's either going to save you and your career or you're going to see yourself struck off. And there's so many cases where this has happened, right? So note taking and systems, as you kind of outlined, spending that time, maybe that downtime where you're not working so much with patients in the early couple of weeks, whatever it might be, and really getting to grips with the systems and how it works with your nurse, your team, the reception, all the rest of it. These are extremely important for the longevity of your career and to ensure that you're profitable as well moving forward. So really, really good points there. Really appreciate that. And I think the rest of us can take that on board. So don't kind of throw away the aspect of getting involved with the NHS, doing the foundation training and learning more than just private dentistry. So good points. Let's move on to the next one here. So we've discussed work, how to get around it. when it comes down to actually finding the right job, organizing the correct contract that works for yourself as a foundation trainee dentist, maybe later on as an associate, what kind of advice can you give there? Especially, actually, just to throw in, especially if you're then considering, do you then have to pay for a mentor? Is there mentorship fees and all these things as well? So for the new guys that are coming in this year and they're thinking about, joining in and they need that mentorship, how does a contract look that is attractive to these trainee dentists that are looking to join the workforce?
So it's really interesting with contracts. Obviously, you want to make sure you're getting a good contract in the sense it's meeting all your needs specifically. So it's an industry standard that there's going to be some form of commitment from dentists who have qualified abroad with working in the UK. It's just it's industry standards. Could be 2 years, could be 3 years, could be 4 years, whatever it is. There is
Yeah.
going to be some form of commitment. And the reason why there's a commitment is because from the practice side, they're investing a lot into you in the sense of your clinical development. They're going to be, in the sense, helping you grow as a dentist in that environment. If you compare yourself, a newly qualified dentist, with someone who's been in clinic practicing for 5 years, just based on that, the one who's been working for 5 years is going to be performing more in the sense like doing
Of
more
course, yeah.
dentistry, charging more experience, more advanced treatments, whatever. So there's that understanding that you're going to be in your initial stages, and you'll find a lot of clinics will want to invest in you to do that, to help you see that through. So regarding contracts, that regarding time length, it's usually around that much.
Okay.
Regarding pay, it varies across the board. So you can either go down an option where you might be salaried for some security. You can be paid per UDA, which is a unit of dental activity, which is how dentists are paid in the UK. So a UDA can refer to, one UDA is like an examination appointment, so like a checkup, or 12 UDAs is like a denture or a crown or an onlay, something like that. So on average, what I would personally say that I've seen most dentists do is anywhere between 3 to 4,000, maybe even 5,000 UDAs per year.
Okay.
My personal opinion, I think what I believe is a good amount in your first year is 3,000 UDAs. And the reason why I say that is that it allows you a little bit of time to obviously get settled into your work, understanding how things are running. It also gives you room to, at the same time, develop your private dentistry. So you don't want to be spending too much time doing your NHS dentistry and neglecting your private dentistry development. You should be doing both of them in tandem. So realistically, there's going to be delays here and there between different people. Maybe they submit the application to the NHS and they take a bit longer than another person. So just to factor all of those in, around 3,000 is a decent amount. Of course, you can do more. People do more, 4,000, 5,000, whatever. But from what I've seen, to be able to continue learning, to continue your clinical development, and also just to enjoy doing what you're doing. So you don't want to be too stressed that, oh my God, am I running behind? Oh, am I falling back with the requirements? Am I going to get penalized for it? It's quite unusual generally for you to get any kind of being penalized for not doing your targets. But there's going to be questions like, what's going on? Like, what's happening? Why aren't you on track? Is there something maybe that's you're not comfortable with? Are you maybe struggling in certain areas? So that's regarding the pay for in contracts. What you'll find as well, if someone's very transactional in the sense that what the contract is what you'll get, that's fine as a base. But I'll tell you from my own personal experience, there was so many things that I got from the place I was working at with Dental Care Group that wasn't part of my contract, but was obviously presented to me. It's like opportunities. So if you have the mentality that you want to provide so much value to the place that you're working, a good employer or a good practice are going to want to facilitate that for you. They're going to want to see you grow and develop and provide you with more and more opportunities. So if you have that mentality, you'll find that contract, yes, there's certain things you should look out for, but be a bit open-minded. Don't be so transactional saying, this is what it says, this is what I'm going to get. Obviously, as I said, it's a base. You need to have that in place, but be open to see who are the people that you're going to be working with. What are they like? Do you gel with them? Do you connect with them? Are you on the same wavelength? So With contract, you'll find there's different types of practices in the UK. Essentially, there's three types. So one, corporate; two, small groups of practices, maybe about 10 to 15, 20, 30, like around that range. And then in an independent practice. So maybe if there's a one or two. So everyone's going to have different preferences. Everyone's going to want certain things. With a corporate, you'll have more like that sense of security. Probably they've established things so much that they're in processes in place. Personally, I don't really gel with that kind of with corporates in the sense that it's not that I'm against them. It's just that it's just not my personality.
Hmm.
I'm more. I would describe myself as more entrepreneur in the sense that I want to look for opportunities. I want to have that chance to grow. I personally don't want to email one person and then wait 2 weeks later for a response to speak to the next person or things like that. Some people are okay with that in the sense that there's that formality. I prefer to get things done sooner rather than later. I want to keep moving forward and be around people who are on the same kind of wavelength. So with independent practice with one or two, that's another great environment as well. But for me, it's missing that drive for that business side, that entrepreneurial side. And then I found that sweet spot with a small group of practices. So
Uh-huh.
15, 20, whatever it is, because the practice owners there, they're dentists, they've demonstrated that they've done that. They've built the practices. They obviously got some business drive in them. They've got that acumen, that business acumen. So that kind of, I assumed that's what I would gel with. And from my experience, that I was right in the sense that that was my personality was suited more towards that.
Okay, sounds great. I think that's a good way to put it. You kind of got the two extremes, the one in the middle. And I think depending on the type of dentist that might be out there that's looking to get the kind of work, they should maybe scale themselves on that and figure out what works for them. So I think one point that you mentioned there that I've actually never even thought of, which makes so much sense, is because obviously I'm quite transactional, as I made very clear, right?
Yeah.
Money, money, money. So for me, it was always like, yeah, man, get 6,000 UDAs in the first year and get it for like 12 quid per UDA and just negotiate, negotiate, negotiate. I think a very good point you made there is that if you actually reduce the amount of UDAs that you have in that year, you give yourself that potential scope to do more private work. Now, of course, that kind of falls on you to find that private work and to put yourself out there and have the confidence to do so. But it's a very good way of looking at it. So I've got a question off the back of that. How easy/hard is it to actually get private work in your first year as a foundation year dentist? Because I mean, a lot of people are just going to have, imposter syndrome that first year. A lot of people are going to feel like they don't know what they're doing. A lot of people are going to feel like, I can't do that on a private case because they're expecting a far higher level of results. So how do you overcome that? And is there actually work there for us?
Yeah, of course. Yeah, I think you should be doing private dentistry from day one. You should be doing
Okay.
that. You shouldn't be scared of it or putting a label on it saying, oh, it's not for me. It's only for dentists who have X qualification or whatever.
Hmm.
You should be getting involved in it. That doesn't mean you need to be doing advanced full mouth rehabilitation cases, but that could simply mean that when you see an NHS patient that it's, let's say it's clinically indicated to have an amalgam restoration on there, but you should actually be offering all the different treatment options. So they should be offered a private composite because that's just you need when you're presenting treatment plans, you should be explain to them all the options available to them. So like not
Yeah.
discriminating them for whatever reason. So you should be giving them everything. And that gives you an opportunity then to do composites. We're trained to do that. Everything you've been trained to do. So that's where it comes again to confidence, and which is why, again, like I said, why I believe in foundation training, because this is why you have your mentor. So if for whatever reason you don't feel confident in a particular case, there's a couple options. You can discuss it with your mentor first. Maybe they could do the treatment first. If they accept that, obviously they need to do their own exam and everything. If they perform the treatment, you can shadow or work with them. You can be the nurse for them for that treatment, just to see how they work and what they do essentially. Or alternatively, you could let your mentor know, look, okay, I'm going to book my patient in on this day at this time. Can you just make sure you might be available if I just need to ask you a quick question or just need your opinion of something? So that's how you kind of work out your mentee relationship to make it work for you. So you can do that private dentistry. So you can obviously build upon that skill.
Okay. I think that's a good way of looking at it. One thing that I think a lot of people probably have a similar question to what I've got now. This mentor thing sounds great. You've obviously mentioned that there is, a time commitment we have to give to the practice or the principal, whoever's, you know, dealt with our contract. The real question is, how much does it cost? Because these mentors are clearly not doing it for free, right? So, what are they getting out of it, and how does that affect our income at the end of it?
All right, so with mentors, they either get paid from yourself, so you have to pay a fee. That will vary depending on the clinic. Or second option is that some clinics may cover that fee for you, and that's included as part of the whole deal, basically, for
Right.
to mentor you. Which is why most clinics will expect some kind of commitment because they're covering that fee for you. The most common thing that what I personally believe in is that obviously our side covers the cost for you. So whoever partner clinic that I'm working with. And another thing which you'll find quite common is maybe a struggle to find a mentor. So one part of my program is that I also incentivize the mentors to be able to mentor you. So separate to basically a deal that I have with you, I'm paying a fee towards a mentor to on top of what they may already be getting paid to help facilitate your development because obviously there's a need for the mentees need a support, but I've also recognized that there's so many mentors that need support too. They
Yeah.
like for
Yeah.
example where I was working, I had a great relationship with my mentor. It was a big practice. There was a few other dentists there. There were three other dentists who were effectively eligible to become mentors with the NHS to mentor someone like myself, but they weren't doing any mentorship. And the simple reason why is they just didn't know what was involved. So it's not really
Ah.
clearly defined. So I all it was me having a chat with them to tell them what the process is like, what's involved, just me supporting them in that sense, like saying, look, this is what I'm gonna need. This is what a typical dentist like myself will need to do to become a NHS dental performer. So once they had
Mm.
that clarity, once the mentors had support, they were up for it. So all three of them
Ah.
wanted to become mentors themselves. So the mentees have a responsibility in the sense that you should make things easier for the mentor to mentor you. There's a reason
Ah.
why dentists want to become mentors. It's one is it needs to be financially viable for them because they're spending time to mentor you, to guide you clinically, time away from patients. Also, they just want to mentor you for their own. It's something different to clinical dentistry. There's a social element too. So they're getting out of the clinic, they get talking with other people in the sense like new dentists, and from their side, they're going to be seeing what we're getting taught in dental school, like nowadays if they've graduated 5, 10 years ago. As obviously dentistry is always changing, so that's the benefit that they will get to. So it's a very mutually beneficial relationship. Both sides are going to need different things for that to sustain itself.
Do you know what? Let's do a video on that in a week or two's time, whenever you got time.
Yeah, sure.
The mentor's perspective, because that's new news to me. In the future, once I've finally graduated in God knows how many years' time, I would love to do that. I think that'd be awesome. I think, kind of trying to give back in
Yeah,
essence, and obviously, as you said, break up the day a bit. So it's not just one thing and just sitting in your surgery room all day long and doing
exactly.
nothing. I think it is nice to kind of coach other people because we were there at one point, right? Like, or I will
Yeah,
be there at one point. You were there at one point, so it's kind of nice to give back, and I think it'd be an awesome episode for us to give out to people that may want to know a bit more how to become mentors. So let's get a date in the diary for that as well at some point.
definitely. Yeah, so that's like my long-term vision with this whole foundation training scheme that I'm running. I, because I've done this effectively, I never thought I would do this, but effectively mentoring like people like yourself or other dentists, dental students to support them. And then I just want that to accelerate. So, like you said, one you're saying right now you're interested in into that, so you already had the seed planted, you already got that in your mind. So it's good you have some kind of direction. So that's my long term vision. Is like I'm kickstarting it, but I want everyone else to make it their own. So in the sense that as I've been developing my own program, it's as I speak to different people, I've been refining it along the way as it goes on. So
Mhm.
long term, so short term, I have my basic course structure, and then long term, we're going to adapt it to the needs for different dentists. So one feedback that I've got is that obviously regarding mentors and regarding how much they're paid, is it financially viable? Whether they can just take a day doing private dentistry, and probably earn more. So there needs to be an element of that. But so finance is important. You can't neglect that. You need it to be viable, otherwise it's just not going to work out. But
Yeah.
you also need to enjoy what you're doing. So there's that aspect too. And one thing that I want to make this a bit exciting for dentists, I don't want it to be like a traditional mentoring scheme that you'll see on a recruitment ad on wherever. So one aspect, I'm incentivizing it for the mentors. Obviously, for the foundation dentists, they'll have their course days, they'll have their training sessions, but also I'm including a grant, so £1,000 for that dentist that they can use towards any particular like CPD courses that they want to do.
Wow.
So everyone's gonna have different interests. So like one dentist might be interested in doing endo, one other dentist might be interested in doing maybe going down the composite Invisalign route and want to go into that. So I have the base structure, but then there's also room for you to choose what you want to do if you want to do a course. Or alternatively, which I'm very passionate about this, is encouraging international dentists to break down all those barriers between, like, for example, Europe to UK. I'm trying to break that down just to make it a bit more fluid. So if you want to do a course, you can do a course, or alternatively, you can. I'd fly you out to any international conference that you want to go to.
Wow.
Yeah, because I recently attended the Chicago Midwinter meeting, and I just thought it was great. It was a great opportunity just to see the latest tech in dentistry. You get to connect with loads of dentists. I think that's so valuable to do, and I think that it's really important as part of your professional development to get involved in things like that. So for example, when I'm interviewing dentists for my program, I'm looking for dentists who are on the same wavelength for me, because that's the whole reason why. Because that's I can provide the most value for dentists like that. If you're a dentist who's like, no, I need to have simple routine, just do my 9 to 5, that's it. And by the way, that is fine. Honestly, I wish I would want that, to be honest. It's very simple, but I want different things. So for dentists who want that typical 9 to 5 or that simplicity, in my opinion, maybe a corporate structure might be more suited towards them. But for like the hustlers, you can say, the ones who want to do the dentistry and then want to do other things, explore other opportunities, I will gel with you. I feel
I like that.
And that's who I can help, and that's it. Because I'm not the only provider. There's loads of providers like that. So you need to find the person who fits you, because that's where you're going to get the most value from.
So I've got like kind of 2 points here. The first thing is, I think it's very, very important what you said there, is to connect with people. And I think I'm doing it as a student right now. I'm trying to create a platform and speak to dentists such as yourself that are fully qualified. I've had the pleasure of speaking to Dr. Jazz Galati, that obviously you met when you were in Chicago, right? I think you were mentioning.
Yeah, exactly. Yeah, I remember. It was great chatting to him.
Yeah. So I mean, it's. I think the advice that I can give from my point, and obviously from your perspective as well, is take any time, whether you're a student, whether you're a dentist, whatever stage you are in your career, take the time to build a network around you. It doesn't matter where you are in that journey, just do it. Reach out to people. And one thing that I've found so far with the dental community, people do seem to be quite forthcoming. I haven't experienced anyone bad yet, right? So fingers crossed, touch wood. But I mean, you've been in there longer than I have, so you might say something different. But anybody who's watching this video or who needs any advice on it, I would just strongly say, and whether you agree with that or disagree, just speak to people. Just don't be afraid to speak to people. I met Dr. Arj, that we're speaking to today, literally because he reached out to me. He was kind enough to do so after watching my videos. And we just hit it off like that, like immediately. And I think people need to understand there's so many people out there that want to help, that want to be involved. We kind of need to get out of our comfort zone and do that. I think off the back of that, one thing I did wanted to say, and correct me if I'm wrong, you said that people that like a bit more structure, and again, nothing wrong with that, that kind of want to just get the job done, tick what they need to tick. They might have a different work-life balance, whatever it might be, compared to those that might be a bit more entrepreneurial, that may want to dedicate more time to their craft. Is it kind of, would you say, corporates on that side? So corporate dentist groups or dental groups on one side, where you've got the guys that just want to go in, tick it off, do their thing? And would you say like more towards, as you said, like the independents or the smaller groups are for guys that are willing to take a bit more of a risk and develop themselves?
Yeah, so these was my personal opinions. This is what I just feel about that. What I would probably encourage someone to do is connect with a dentist who's working with a corporate, because they'll have their own personal experience. I've not worked for a corporate, so to be honest with you, I'm not the best person to actually say what it's like working for a corporate. So again, these are just my opinions, but I would recommend, if you're in that position that you want to know what corporate dentistry is like, connect with someone who's working in one of the corporates. I've heard great things about corporates. I've heard anywhere you work, you're going to hear good and bad things.
Of course.
That's going to be anywhere you go. But when it comes to looking for the bad things, just try to assess what those bad things are. Like, are they easily fixable, or is like a fundamental issue? That's something to probably look for. Just because we're touching on the topic of networking, one thing that I've found, that one thing that you did very well that other people may not, is that when you're networking with people, when you effectively want something, and let's say it's time with them to talk through things, you can't just say, oh hi, can you come on a video for me, and for whatever it is, like a half an hour, an hour, with no context. You're on a mission. You're building this platform to support dentists abroad with working in the UK, and you're building that platform. And I resonate with that, so I want to contribute to that. I can see how passionate you are on this, and that's, like I said, that's what I like. That's what I gel with. So then from there, we're working on that, and I'm looking forward to doing more videos with you, by the way.
Hell yeah,
so,
yeah.
yeah. So it's kind of, when you're networking, just try to have, this is how I take networking. Like, what can you do for the other person, not what you can take from them. What can you provide the other person that they're gonna want to spend that time with you? Why are they gonna spend, let's say, Saturday morning having a coffee with you, talking you through whatever? Like, there needs to be some context. It needs to be like a win-win situation for both of you, or have the same direction, like you both trying to work towards providing value in whatever it is that you're working towards.
Mutually beneficial.
Exactly.
All right. So on that note, then back to the mentorship. What would you say are kind of like the red flags and the green flags for students and new graduates to look out for when it comes to finding the right mentor?
So what you should be doing is, when you're having your interview, you should probably assess the person who's interviewing you, just to see how your personalities, if they match, or if there's a slight clash you feel. You should see if they've had experience with mentoring before. That can give an indication. If you can have a chance to speak to any other dentists who got mentored by that person. And also, if there's a mentor who's new to mentoring, that's not a problem too. So you should be looking for a dentist who's experienced in mentoring. They want to do mentoring for the right reasons. They want to give back to the younger dentists. They want to help support you. If they have that genuine passion, that will come across from the way they talk. If it's coming across like it's just a tick box exercise, oh, I have to do this, this is my thing I need to do, then you know that, in my opinion, that might not be as successful as it could be if you were working with someone who genuinely wanted to help you. And there's also, regarding red flags, I would say it's probably quite hard. I haven't really come across anyone who's like, you'd say like a bad mentor, but a red flag you can say is that if they're just not really receptive towards you, if they're a bit not hostile, but a bit more, maybe they're not understanding that as you're starting out, you're gonna be probably asking a bit more questions than usual. That if they're more focusing, oh, I could be doing something else instead of this, instead of helping you out, spending all that time. Because I'll be honest with you, when I first started working, I think my first day, I saw about 10 patients, and I think probably every patient, I knocked on my mentors, I had a quick question. So it's gonna happen, and they will probably know that too. But you'll get that experience with time, to the point where you don't really see your mentors much for those kind of questions.
Exactly. Yeah, that's the whole point of it.
So yeah, a good mentor, it'll feel like there's a safety net, so you don't have to stress, in the sense that if you're out of your depth, you know there's someone you can go to ask questions, or to show a periapical radiograph, or whatever it is. You can have that there.
I could see myself saying, "Oh my god, I got my contract in my hand. I just want to sign this damn thing and just start."
Yeah.
And I think it is important to take a bit of a breather, take a step back, maybe understand who am I going to be paired up with for the next 9 to 12 months at least, right? And understand who my mentor is, and get a bit of a feel for that person as well. And I think something that you mentioned there as well for us to understand is, the first few parts of that mentorship, we're going to be knocking on that door. we're going to be asking for help, and it is going to come across maybe to ourselves as quite awkward, but for maybe a more experienced mentor, it'll be quite normal. But quite rightly, as you said, it's something that will transition into becoming fewer and further in between that we need their help, and things would just start flowing. So understanding who our mentor is and interviewing them while we're at the interview is a very, very strong point to mention, and something for us to learn from. I think we shouldn't be scared at a point when we're being interviewed for a position. Should be open enough to have the confidence to understand what we're getting ourselves into. And I think, if we can get that vibe, as you've said, that's good, then so be it. I think anything beyond that, it should be quite plain sailing. So one thing for me that I've learned from you, I think we had a call offline once. You mentioned when it comes to mentorship, it's not just learning dentistry. I remember you said it was beyond the clinical side of things. It's more so, that professional learning. It's how to become a better entrepreneur, how to be more profitable, how to have better communication skills. And there's so much more to it than just in the chair, right? So these are like bonus points almost. So, if you want to elaborate on that, that'd be great insight.
Yeah, exactly. The reason why I talk so much about the non-clinical side is because when you're in dental school, the priority is your dental education, the clinical side. So you're going to be focusing on all of that. You're going to focus on that clinical education. When you graduate, you're going to continue that naturally. You're going to want to keep doing courses. You're going to want to keep finding what you're interested in to pursue that. That's already inbuilt in you just from that experience. Whereas what you don't really see in dental school is what you should be doing that's non-clinical that can help you with your career. So that's why I like to talk about that, because I've gone through that side of the non-clinical side in addition to the clinical side. So I obviously went through a foundation training equivalent. So I had all my clinical education courses on restorative, perio, endo, all of that. That was all done in clear. But this side is super important, like networking, the entrepreneurial side, learning the business of dentistry, if that's what you're into. If you've got your eyes on practice ownership, being around people who can help you down that path, it's that you don't learn at dental school, you learn on the job effectively.
I'm with you. I'm with you. And then, so just to kind of wrap it all up, if somebody was interested in getting in touch with yourself, what would be kind of the steps you take them through from, you know, introducing yourself and them introducing themselves to you through to them getting in there with a mentor? How would that whole process play out? And how would you advise that person to get in touch with yourself on it?
So all you need to do are, all my socials will be at the link in the description. All you need to do is connect me on whatever platform. If that's Instagram or LinkedIn, by the way, I highly recommend, if you don't have LinkedIn, you should really get onto that. It's a great networking tool.
I'm back on LinkedIn because of him. I'm just letting everyone know. I'm literally like, I'm still not good at it, and I need to be a little bit more on the ball with LinkedIn. But Dr. Arj is the guy that kind of said, "Mate, you're missing out." So if I'm doing it, then you all got to do it as well. So carry on. Sorry.
So you can reach out to me on Instagram or LinkedIn, and all you need to just strike up a conversation, just say hi, and then what we'll do is we'll arrange a call with, if you're interested, if you're a final year dental student, you can even have that conversation now. You don't have to wait till you graduate. So how that would work, if you're a final year dental student, if you have that conversation with me now, if you're suitable and we give you a conditional offer, those conditions are that you graduate and then become a GDC registered dentist. So we can start having that conversation now. You don't have to wait till you're a dentist to figure out your place of work. We can start that process now. If you're already a dentist, again, just reach out to me, and then whatever vacancies I have available, I can talk you through that, and then we can take it from there. So just need to connect with me on socials, and then we'll arrange a call.
Perfect, perfect. So there you have it, guys. He's the most available guy to talk to because although he's super busy, by the way, he's a very, very nice guy. He's given me the time to make this video with him, which I massively appreciate. And I've fobbed him off a couple of times as well, so I do apologize because we've got exams on our end, so we had to reschedule a couple of times. But that's how flexible he is. And truly, I would say, just from the experience I've had with him, he actually does care. He's not just doing it for the money or doing it for his own reasons. He actually does care. He's given me a lot of his personal time offline to really help me grow as well as an individual. So massive shout out to him. And hopefully the rest of you guys can take advantage of the advice he's giving. So definitely get in touch with him. I will leave all of his socials in the link in the description below. Sorry, should I say? So once again, Dr. Raj, thank you so much for coming along today. You're calling from where? You're in the States, right?
Exactly. So that's a story that's I'm carving out now. So I'm currently in the States. I relocated here about 6 months ago, and it was actually a couple of weeks ago I found out I passed the American Dental Board exam. So,
Congrats.
so what I personally believe as well, the reason why I don't talk about that too much right now is that I believe that I'm in a position to talk confidently and accurately about the transition from Europe to UK because I've done that path myself. I'm not a recruitment agency saying this is the job, you can go here. I've literally done that. I know that process really well, and I'm happy to help you through that. And I have a program that will help guide you through that. So that's why I do that. Now, as I'm carving out my path here in America, I'll eventually start talking about it more and more. So, or about the board exam, it took me a few months to study, but I can even talk about that now, about how to do that. You don't even have to be in America to actually study for that exam.
Wow,
Yeah,
that's insane. That is insane. I was about to say, do you know what? We definitely get so many people that ask about this. I get people in my own uni saying,
yeah,
"Yo, do you know how we can get to the States from here?" So this is, I feel like genuinely we should do a whole video about this. Like honestly, I think it would blow up
yeah,
because
definitely.
there's so many people that ask for it. I mean, even I'm curious to know how it's done. I feel like I might have missed
Yeah,
the boat a little bit with the age, but I genuinely am really curious as to how it is. So if you're happy to do it and if people want to see it, then we could make a whole video about this if you're up for it.
yeah, yeah, definitely. So like I said, one thing I'm really passionate about is like breaking down barriers between countries regarding dentistry. So Europe and UK, I'm breaking down, and my long term plan is to do the same thing with Europe, UK, and the States. So in the
Uh-huh.
States, from my because I've obviously spent a lot of time delving into that, researching that. Effectively, the United States, 50 states, 50 different rules and regulations.
That's painful, man.
Yeah,
That is painful. Yeah, that is definitely going to be a video and a half. Then, 100%.
yeah,
We definitely have to do that one. So that's awesome. I think as I said, massively committed to the cause. He's doing it from God knows how many hours before. I mean, I'm sitting here at almost midnight, and what's the time where you are right now?
for me it's fine. It's nearly 5 o'clock, so
Yeah,
it's
there you go.
worth
So
for
he's
you.
chilling. So yeah, he's still backing it up on the weekend to make this video happen. So once again, Dr. Isaac, really appreciate all the input. We'll try to make a little mini series. We'll get some more questions and feedback from the community. Make some more videos to answer the questions that people might have, and hopefully we'll be seeing you again very soon, my friends. So thank you very much for coming on.
You're welcome. Thanks for having me. It was great.
Take care, my friend, and I'll see you guys on the next one. Take care. Bye bye.